As women approach their due date, there are a lot of apprehensions about how exactly the labor pain is going to be, and a lot of women are worried if they will actually miss out on the labor contraction. Believe you me, labor contractions is not something that you can miss out on. However, the reverse can be true sometimes. You may confuse false labor pains or the Braxton Hicks contraction with the labor pains. From around 32 to 33 weeks onwards, a lot of women start feeling something known as Braxton Hicks contractions, which are painless tightening of the uterine muscle. The whole abdomen will feel tight. However, these contractions are not painful. The woman will not feel pain, and there is no pattern to these contractions. It will suddenly come, it will suddenly go. So you will not be able to confuse this with labor pain. However, in the last 3 or 4 weeks, there is something known as false labor pain, which again is very irregular, does not continue, and does not increase to the extent to which the labor pains do. Labor pains will usually start at regular intervals. Initially, it may be just once in half an hour. Each contraction and pain may last just for 15 to 20 seconds. However, you will find that the intensity of the pain, the duration for each contraction lasts, and also the interval between two contractions will keep shortening. What I mean to say is, what started as once in half an hour may become once in 20 minutes, once in 15 minutes, once in 10 minutes, and each contraction will start lasting for a longer duration of time. From 15 to 20 seconds, it will become 30 to 40 seconds. So when you need to reach the hospital is when you are continuing to have contractions and pain every 15 to 10 minutes, each contraction lasting for around 20 to 25 seconds, and the intensity is also increasing. You need to reach the hospital. However, some women may not have labor pain, and the water bag may break open with watery discharge. So if any of you have water discharge, kindly do not wait for the contractions to begin. Please reach the hospital, because it means that the baby is ready to come out. Hello, I'm Dr. Poorni Narayanan, Associate Consultant at the DIVAKARS Speciality Hospital, Bengaluru. A baby within the uterus starts moving from around 7 weeks onwards. However, it takes up to 20 to 22 weeks, that is by the end of the 5th month, for a woman to perceive these movements. In the last few weeks of pregnancy, maybe 5 to 6 weeks, we make the lady aware of the movements and ask her to count a certain number of movements in a certain number of hours. The reason why we do this is, one, the last few weeks of pregnancy are more important, and we monitor the patient on a regular basis. We call her once a week to make sure things are fine. But because it's not possible for us to see her daily, we ask her to make sure that her baby is fine. How does she make sure that the baby is fine? Baby which is moving well ensures her that her baby is fine. Towards the end of the pregnancy, the baby grows to almost its full size, and the space for the baby to move is not as much as what we would expect in the 5th, 6th or 7th month. So even though the number of movements will remain the same, the intensity of movement may be slightly less. So we ask the lady to focus, concentrate, and count at least 5 or 6 movements in a time frame of 6 hours in the morning, and again 5 or 6 movements in a time frame of 6 hours in the evening. For example, if she happens to wake up at 7 in the morning, by 1 in the afternoon, she should have at least 5 or 6 movements. And again, if she focuses and starts counting around 4 p.m., by 10 p.m. at night, she should be able to count 5 or 6. This doesn't mean that the lady has to be extremely anxious and keep sitting and counting throughout the day. She may invariably finish counting 5 or 6 movements in an hour also if she focuses. And if she doesn't feel any movement for a couple of hours, then we do suggest that you contact your obstetrician just to make sure that things are fine with the baby. A baby within the uterus starts moving from around 7 weeks onwards. However, it takes up to 20 to 22 weeks, that is by the end of the 5th month, for a woman to perceive these movements. In the last few weeks of pregnancy, maybe 5 to 6 weeks, we make the lady aware of the movements and ask her to count a certain number of movements in a certain number of hours to make sure that her baby is fine. We ask the lady to focus, concentrate, and count at least 5 or 6 movements in a time frame of 6 hours in the morning, and again 5 or 6 movements in a time frame of 6 hours in the evening. This doesn't mean that the lady has to be extremely anxious and keep sitting and counting throughout the day. She may invariably finish counting 5 or 6 movements in an hour also if she focuses.